This video will be talking about the new social innovation idea called the neighborhood. For decades, professionals have decided the best way to help those with mental health disorders is to lock them up until they are stabilized on medication to manage their symptoms. The hospital environment results in agitation as some clients are unable to go outside and are confined to the small mental health unit. In addition, these medications tend to have a negative effect on cognitive and motor skills. This makes it difficult for clients to obtain jobs, go back to school, and participate in activities in their communities when discharged from the hospital environment. The inability to adjust to their lives outside of the hospital puts added pressures on caregivers to help them navigate their daily lives. This lack of adjustment also tends to result in clients relapsing due to the added stress of trying to reintegrate into their community, or they decide to go off their medication as they have difficulty adjusting with their side effects. Introducing the neighborhood. The neighborhood is built to funnel clients out of long-term mental health units and hospitals and into a locked, gated neighborhood community that would be built in a rural area. When clients are brought into the emergency psychiatric unit at their hospital, rather than moving to the long-term acute mental health unit, they would be brought to the neighborhood for treatment. The entrance of the neighborhood would be locked to accommodate both involuntary patients, who would not be able to leave the confines of the gated community, and voluntary patients, who would be able to enter and exit the neighborhood. In this neighborhood, clients would be put into houses based on their symptoms that are equipped with nurses, doctors, social workers, and other staff that would be employed in hospitals. Within these houses, clients will receive programming specific to treating their symptoms. There would also be a community center that would be a space to integrate all houses and would have programming beneficial to all mental health disorders, as well as life skills programming, games, a media center, and a library. Within this neighborhood, there would be restaurants accessible to both clients and visitors. When clients' symptoms are stabilized and they are beginning to transition home, they would be able to obtain employment at these restaurants to build practical skills for when they are discharged from the facility. This environment would not restrict clients to staying in a locked, small unit, but would give clients the freedom to leave their care houses and walk around the gated neighborhood. In this model, clients wouldn't only receive medication management, but would also learn how to better integrate into their communities upon discharge of the facility. To build this facility, we would need to start by creating a social investment fund where private investors can contribute to provide the money for the initial costs of building the neighborhood and hiring staff to open the facility. We would set up a social enterprise by renting out space for restaurants and office space for community agencies. This would be beneficial to these community agencies as it would create awareness of the agency, would allow them to provide programming within the neighborhood, and would allow these agencies to transition clients into their services when discharged to their home. We would also create partnerships with hospitals where they are able to refer clients into the neighborhood on a fee-for-service basis, and work towards obtaining government funding, as this neighborhood would be a more cost-effective strategy compared to in-hospital acute care units. Our goals are to create an easier transition for clients from in-mental health treatment to reintegration back into their communities. To help clients build strategies for independence to help them rely less on caregivers, and to decrease readmission rates of clients back into the mental health system. We will evaluate these goals by comparing results between inpatient hospitalization programs and the neighborhood facility on caregiver burnout using the Maslach burnout inventory, how often clients rely on their caregivers in a week, and readmission rates. The neighborhood moves away from an institutionalization model to a more community-based treatment for those impacted by mental health. It will work towards not just taking medication into account when looking at treatment, but working with clients to successfully live their lives on their new medication and with their mental health diagnosis. Let's create a practical treatment model for mental health care. Let's create the neighborhood.